you guys, it's Ashley Myers, and I will be talking to you about the perspectives on mental disorders from Chapter 8. Mental disorders are represented by three different perspective models, which are medical, psychosocial, and labeling. Both medical and psychosocial models stem from positivist perspectives, while the labeling model stems from the constructionist perspective. The medical model states that mental disorders are more nature or biological rather than nurture environment. In the 70s, it became popular for psychiatrists to prescribe their drugs to their patients as a way of treating their mental illness. The medical model believes mental illness should be treated like a physical disease as they are similar in terms of being biological. Therefore, medication is thought to have more of an impact than a regular therapeutic talk session. Medical professionals came to this conclusion based on their studies of the identical twins. According to Coleman in 1992, if one identical twin suffered from major depression, then the other one had a 78% chance of having depression as well. This led to the conclusion mental depression runs in the family. In 1974, schizophrenia was determined to be 3.5 times more common among one's biological family member versus non-related family members when considering adopted youth's diagnosis. In the 50s, hospitalized schizophrenics were given Thorazine, and once that proved to be successful, other antipsychotic drugs were given to treat mental illness. Over the next 20 years, 500,000 schizophrenics were released from hospitals due to medication success. Since the 1970s, antipsychotic medications such as lithium, Clorazil, and Prozac effectively treat 2/3 of people with schizophrenia, depression, and other mental disorders. Since genetic factors are key in developing illnesses such as diabetes, coronary artery disease, and hypertension, it is believed to be a key factor in one developing mental illness. Mental illness is believed to originate from a chemical imbalance in the brain. Although some people are more prone to having a mental illness from genetics, there are social factors that take place. Medications only treat the symptoms of mental illness and not the cause of it. The psychosocial model has two versions, which are psychoanalytic theory and social stress theory. For the psychoanalytic theory, Sigmund Freud states mental disorders stem from unresolved psychic or emotional conflict within oneself. Freud states conflict is inevitable due to a person's personality having three conflicting parts known as the ID, the ego, and superego. ID is governed by the pleasure principle, where one is willing to do anything and everything, regardless if it is immoral or illogical, to get self-gratification due to having animal desire for sex and aggression. Ego is developed from ages 1 to 3 and operates within the reality principle from interacting with one's environment. Ego conflicts with ID as it is rational and logical and considers morals. It mediates between ID and superego to allow one to have reasonable pleasures. Most conflicts rise during childhood. Superego also restrains how far one can use ID and control one's impulse as it internalizes morals from ages 3 to 6, from parents or society, also known as the conscious. If the ego fails to mediate between the ID and superego, then one develops neurosis or psychosis. When one represses its conflicts, it develops into anxiety, depression, or compulsion. It then needs to be brought to the forefront to fix the conflict. Social stress theory. Social stress has been studied in the 1980s and have found that 20 to 40% of people never fully recover. Social stress significantly contributes to mental illness. Employment conditions are proven to negatively impact people's lives. Unpleasant conditions as hazards, noise, heat, humidity, fumes, and the cold play an ideologic role in the prevalence of schizophrenia in lower-class people. One can avoid mental illness by having or using adequate coping skills. Mechanisms such as social support, personal skills, or actively solve problems, seek information, and reduce tensions by using humor. One must also have high self-esteem. The labeling model. Mental illness as a